It's icky and it's sticky and it could obstruct your hearing, but that yucky brown stuff does have a purpose. Earwax is a self-cleaning agent with protective, lubricating, and antibacterial properties and helps keep dirt and bacteria from getting inside your ear canal. Earwax buildup will normally find its way out of your ear canal as you chew or make other jaw movements. Eventually, dried up clumps of the gunk will fall out of your ear. The specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery explain that unless you have an earwax blockage, it's best to leave your earwax alone.
Some of the common conditions that I see are impacted ears, a lot of cerumen impactions, nasal allergies, sinus infections, hearing loss. Impacted cerumen is otherwise known as earwax. Cerumen impaction is a normal process of the buildup of cerumen gland material that's in the external auditory canal, so the outer ear, and it can block the ear canal and cause hearing loss, ear pain, infections, drainage. Some of the ways we get cerumen or earwax out of the ear canal is by using a vacuum, which is common, using a little bit of oil and suction, or some handheld tools where we can manually remove the wax. No Q-tips. Q-tips can actually cause further impaction, and some people have actually ruptured their eardrum from pushing the Q-tip in too far.
Q-tips. It's probably the vein of my existence. Q-tips cause so many problems. Everybody thinks that it's actually used to clean their ears and get all that wax out because it's bad. Wax is actually good, and it should be in their ear a little bit. They should just use a wet washcloth and have it right there on the outside of their ear canal.
For more information on this story, as well as the links to the specialist at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click the Wax Facts story link icon on our homepage at yourhometownhealth.com.